This Safety Minute video is brought to you by the Safety Coaches and Infection Control. Isolation precautions with donning and doffing PPE. Our isolation signs are clearly posted outside of our patient rooms on the isolation cart or caddy. It doesn't just list the type of isolation, it also tells us the order that we should don or doff our PPE for the specific type of isolation that the patient is in. Stick around to the end of this video for a nice demonstration of the difference between droplet and airborne isolation. For contact isolation precautions, you'll see this bright green sign. To enter the room, perform hand hygiene, put on and tie your gown, cover the cuffs of your gown with gloves, we don't want a skin gap, and then perform patient care. To exit the room, simply remove your gloves, remove the gown in the room, place within the trash receptacle, and perform hand hygiene. It should be of note that this is contact precautions when we are not under some sort of universal masking for a flu surge or pandemic, so there's no mask involved. If a mask is involved, it's because we have required it for all patient care, not just isolation. At the top of this sign, it's also posted that all visitors should report to the nurses station because we want them to also comply with PPE standards and not spread infection from this patient's room. I personally like that the back of each of these signs lists the types of diseases that this patient could be in isolation for. This gives us a good idea if we're ever trying to troubleshoot if the type of isolation precautions are appropriate for our patient. A reason that the patient could be placed in contact isolation are things like hepatitis A, lice, and scabies. Within parentheses, we can also see any type of condition or caveat that could change a patient from one type of isolation to another. Droplet isolation precautions are identified by this bright orange sign. To don our PPE prior to entry to the patient's room, simply perform hand hygiene, put on and tie a gown, put on a surgical mask on your face for routine care, and cover cuffs with gloves. To exit, remove gloves, remove gown in the room, and then remove your appropriate mask. At the end, perform hand hygiene. The reason for the order in doffing PPE for droplet isolation is you don't want to touch your mask with contaminated gloves. On the back of this sign, we can see reasons that a patient could be in droplet isolation, and this includes influenza, RSV, and mumps. We would also make sure to clean any type of portable equipment with the purple top Sandy wipes before we take that equipment to another part of the hospital, just as we did with contact isolation. If this patient is being transported to another department, such as an ancillary department for testing, that patient would also have to don a surgical droplet mask. And this will help prevent the spread of disease while that patient is being transported. Please note that if a patient is receiving any type of aerosolizing procedure, it could take a patient from being in droplet isolation to requiring airborne isolation precautions. Airborne isolation precautions are clearly identified with this bright pink sign, and these patients are going to be most of the time placed in a negative airflow room with an anteroom. So when we're donning our PPE, it's going to be done within that anteroom. To don your PPE, perform hand hygiene, put on and tie your gown. Before entering the room, put on an N95 respirator or PAPR, whichever one you have been fitted for by Employee Health, and cover cuffs of your gown with your gloves. To exit, again, we're going to only take our mask off in that anteroom. You will remove your gloves, remove the gown in that anteroom or outside of the room, and then remove your mask, your N95 or your PAPR. Then perform hand hygiene. On the rare occasion that a patient may have to be transported from airborne isolation to an ancillary department like CT that cannot perform a portable, this patient has to wear a surgical droplet mask, and that prevents any of their droplets from becoming airborne. Don't forget to wipe down and clean any equipment that has gone into the patient's room or that the patient has come into contact with. Enteric contact precautions are a little bit different and are noted by the brown sign. This signifies C. diff. So, what do we do differently with enteric contact precautions? We're still going to perform hand hygiene, still going to put on and tie a gown, and still cover our cuffs with gloves. When we exit the room, though, to doff our PPE, we'll remove the gloves, remove the gown, and wash our hands with soap and water. This is because C. diff is a spore and hand sanitizer will not kill it. The other reason that we will, or other thing that we will do differently with enteric contact precautions is that we will use the bleach sandy wipes. So the orange top sandy wipes to kill C. diff. We'll make sure to wipe down any equipment, and if this patient goes to an ancillary department like imaging services, we'll also wipe down with the orange top sandy wipes and perform a terminal clean through housekeeping. CRE is another reason that a patient could be placed within contact precautions, but because of the high mortality rate, we're going to identify this with this bright red sign. We'll treat it just as we did with contact isolation precautions, but we'll follow up with orange top bleach sandy wipe cleaning, as well as a terminal clean through EVS that includes the UV treatment on any equipment or room that the patient has visited. The blue special droplet contact precaution sign means COVID-19. This reminds everyone how to perform contact and droplet isolation precautions, but also that if there's something like an aerosolizing procedure going on in the room, that staff would have to wear an N95 or PAPR with eye protection. We've mentioned a few times of something being an aerosolizing procedure and that requiring airborne isolation precautions. What are the aerosolizing procedures? Well, here's what they are, and along with the equipment of what it might look like at our facility. So, this is a vent. This could mean that our patient is hooked up in the ICU, for example, and that would be an aerosolizing procedure that would require us to wear an N95 or PAPR hood if that patient has one of the qualifying diseases like COVID-19. Another aerosolizing procedure is the patient having a trach, a BiPAP. By the way, if you want to know more about this equipment, these images are from RT Clinic on YouTube. Check out what Jimmy McKenna has to say about those. Heated high flow oxygen. This is what that looks like at our facility. Venturi masks, non-rebreathers, and even the patient being on 6 liters of oxygen or more. Easy way to spot that is our green tubing is used for patients who are on 6 liters and above. So that is an aerosolizing procedure. Something else that would qualify is if this patient is having CPR, because one of these things is most likely going to happen. They're probably going to be intubated, and then that would put us into needing our N95 or PAPR to protect ourselves. So, if you join the healthcare field during the pandemic, it may be a little hard to understand about masking or why we need it when your entire experience has been with masks on when you are in front of patients. So, here is a visual demonstration of why we would have a droplet isolation. This is just with a spray bottle. So this is what happens to our patients when they have something like flu, they cough, they sneeze, or they even talk. See all the droplets that come out of that spray bottle? That's what we're worried about with that type of isolation in those patients, because then those droplets can contain disease that can infect others. What about aerosolizing though? Well, here's an aerosol spray bottle, and look at the fine mist that it produces. It's not the same thing as a droplet spray bottle. And that is those aerosolizing procedures that we just talked about, or certain types of disease where we're worried about that disease hanging out in the air for longer. You might wonder how much your mask is protecting you and how much it's preventing from coming from that patient when that patient has a surgical mask on. So let's try that with the spray bottle. This is a simple surgical mask and just give it a spritz. You don't really see any droplets coming through that mask. And that's the principle of having our patient wear that mask to protect others when they're no longer in their room. You might wonder if a surgical mask really works on a patient who has a disease like tuberculosis. They are in airborne isolation, but how is that surgical mask on the patient's face going to protect us? We'll watch the demonstration with our aerosol spray bottle and a droplet mask. Again, the goal is to prevent any of that aerosolization from coming out into the room and into the air.